everyone. I'm looking for a clicker. I'll be right back. Thank you. All right. So how many of you think I will start with the question? Raise your hands. OK, long day. Not many of you are listening. I just did start with the question. Anyway, it's nice to be here. Thanks to Rob for inviting us. Also, thanks to WLSA for connecting us. Many of the good things that Walgreens is doing is due to the relationships that we built and sustained through WLSA. So I'm here to offer our perspective on mHealth, connected health. I am here to tell you a little bit more about Walgreens. And I'm here to comment on how we can work together, how we can partner to create the market, to help people achieve better outcomes, to help change healthcare in our country. But first, personal example. Some time ago, about a year ago, I was just finishing my lunch, and I was done. I got back into my car, and I tried to start it, and all of a sudden, the voice from the sky talked to me. Mr. Gershfang, this is the customer center from your car manufacturer. We are here to make sure you're safe and ask you a few questions and offer a few recommendations. And I'm like, OK, talk to me. And they said, well, over the past months, your car has been sending some data to us, to the mothership, and a pattern emerged that caused us to be concerned about the health of your vehicle, literally your engine and transmission. So the questions we have: had you noticed slight vibration as you were driving or starting your vehicle? And I'm like, not really, but now that you mention it, yeah, there was some signs of that, but I didn't care that much about it. Well, so we see this as a sign that something is going wrong. We recommend you stop by at the nearest service center just to make sure we can examine it further and fix it if there is a problem. Like, OK, I had an extra 30 minutes. So like, OK, this is the nearest service center. We'll guide you to it. They're expecting you right now. So I go there. They are expecting me. They said, Mr. Gershfang, here's coffee. Wait 15 minutes. They come back in 30. They said, yes, there was a problem with the software on your electronic fuel injection. We updated a new patch. We downloaded some software. It's all good now. So as I was reflecting on this experience, a few thoughts occurred in my mind. First, is my car smarter than me? And in some ways, it is. It's sensing a lot of things that I don't. But number two, is this mHealth for cars? Should there be mHealth for people? And lastly, this is that end-to-end holistic horizontal model where a big picture emerged. The data was collected, transmitted. There was connectivity. There was analytics. They analyzed that all the signals meant that there's something about to go wrong. And then there was a human element that was involved to walk me through this experience and to fix it. So some action and intervention. Now, imagine if transmission, engine, tires, whatever it is, had different websites, different companies, different centers, right? And they would all, so I would have to be like aware of 17, 20, whatever, 57 different things trying to contact me. So this holistic end-to-end model, we believe, is something that is needed for mHealth to take off. So our definition of mHealth or connected health is personalized tracking and management of wellness and health anywhere, anytime. And to us, it's another effective tool to help our patients and customers and consumers do that. So, by now you're thinking, OK, that's great. What does Walgreens have to do with this? You are a retail pharmacy. And that is true. We are a retail pharmacy, but we are actually, and it's a fact, we're a wellness and healthcare company. Pharmacy is just one product that we have. And if you look at the slide, this is just a sample of multiple offerings and products and businesses that we have. We operate retail clinics. We are pioneering retailization of health. We offer acute and chronic care services there. We have adherence programs, wellness programs. We offer health testing. We operate embedded pharmacies in the hospitals. We operate health clinics at workplace centers. In fact, majority of Fortune 500 companies have our workplace health clinics. So we operate well transitions, post-discharge programs and services. So in a nutshell, we have in this country alone 9,000 points of care. And we are in every neighborhood, we are in every community. 75% of US population lives within 3-mile radius of Walgreens. So if you look at this, and before I go to the conclusion of this, we recently acquired a significant stake in Alliance Boots, which is a UK company that operates and have points of care in another 40 countries around the globe. So if you look at this footprint, we offer tremendous access for patients and consumers, and we can operate and deliver and offer acute and chronic and wellness services at an affordable cost, at scale, in a standardized way. And that is a mega platform that we all can use. And mHealth could be plugged into that. We have more than 25,000 pharmacists and nurse practitioners that offer direct guidance and coaching and consultations to customers. And through our field studies and surveys and data that we see, the effectiveness of mHealth, that engagement rate that everybody's talking about, depends on direct touch. It's too complex these days for people to figure out themselves. It's too complex for consumers to know what to do with the data. So all the self-service and self-management aspects can only take us so far. For real results, we will need services around devices and sensors. We will need programs. We will need this holistic end-to-end solution. Let's see. How do I advance the slide? OK. So mHealth is a big part of our healthcare strategy. We recognize this for use cases, if you will, or product categories. Wellness, fitness, education, right? That's quantified self movement. That is fitness fanatics, but also average consumer who is trying to employ healthy behaviors. We have health testing, screening, and diagnostic services. Again, self, right? Remote screening, remote diagnostic, something that people can do at home, and then what to do about it, they come to us. Chronic disease management, that's obvious, but it's continuous observations, alerting, right? We believe in the model where we're moving away from kind of episodic snapshot healthcare where people see doctors only when they have to or once a year. We believe now in more continuous assessment, engagement, actionable information coming out, and then interventions. And then remote patient monitoring, where we are solving problems like adherence to medications, adherence to care plans, home care, aging independently, aging gracefully. So these are the product categories that we're actively developing or launching or rolling out. And this is how we can work together. And one thing I haven't mentioned yet, part of our assets, part of our infrastructure, where we can plug in the ideas, products that we collectively create, is something we call Walgreens Health Cloud. It's an open health cloud, which is a collection of components to do the data collection, to do the data aggregation, to do the analytics, to have engagement features, to have the reach out campaigns to our patients and customers and consumers. So a lot of companies like yours, we were able to plug in your assets, your products into Health Cloud at your benefit and at the benefit of consumer because they have seamless integrated experience. So really quickly, because I'm running out of time, in summary, how can we work together? We offer, obviously, access, reach, scale, standardized, more affordable because of that scale. End-to-end, I just talked about that, more holistic experience where customers don't have to log in and live through multiple disjointed experiences. Direct interaction and engagement with patients. Like I said, our service practitioners, our frontline practitioners talk to customers all the time. We see 10 million patients and consumers a day through all of our channels. We are part of the value chain. We are part of the transaction flow. That's why customers come to us, right? That's why pharmacists are becoming consultants and health guides to guide your shopping, to guide your healthcare experience. So that all means that there's broader adoption, higher engagement rate, better outcomes. Obviously, there's distribution and retail, right? We can put your products on our shelves, our physical shelves and virtual shelves. We operate significant online properties. Our mobile app is consistently rated at the top 10 in Apple iTunes Store. So we can put to use all of these assets when we plug you in or we share the data at least. We offer connectivity with other healthcare providers. So when consumers come to us for meds or other services, we have a way to communicate their health records to their primary care physicians or specialists. We have this sophisticated healthcare data exchange plumbing that is part of that health cloud. Point number 7, like I talked before, it's all about bundled solutions. Devices alone will only take us so far, and we've heard reports these days that typical user uses the device about a month, 2-3 months, if there is no overall program, goal-oriented program with all the service components built in. I talked about our own clinicians. Point number 9, when we see good idea, when we see good product, when we see that it's worth investing in certain products, companies, and ideas in order for this to take off and benefit a greater population and take it to mass market adoption, we have an investment arm. We operate a VC fund as part of our company, and my colleague is here. We constantly talk to different customers and investors and partners to see if we can make a strategic investments. And lastly, like I said, this health cloud platform that kind of ties it all together at the infrastructure level to have a seamless, holistic, integrated solution. So in the end, I will say that if you believe that your idea is a radical innovation or something that can move the needle or shape that health market for us, let's connect. Let's talk about it. We can collectively figure out how to drive change in our country. Thank you.